Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. The primary CPT code used for a sternum series is 71120. This code represents a radiologic examination of the sternum with a minimum of 2 views. These X-rays show at least 2 different angles of the breastbone to give a clear picture of the sternum. The CPT code 71130, radiologic examination of the sternoclavicular joint or joints, a minimum of 3 views is used when X-rays are taken to evaluate the joint where the sternum or breastbone meets the clavicle or collarbone. To meet the criteria for this code, the radiology study must include at least 3 views, typically using postero-anterior and oblique projections. The goal is to fully visualize the alignment and spacing of the sternoclavicular joints. The standard views included in a sternum series are the chest lateral view, the chest PA oblique view, right anterior oblique, RAO, the chest PA oblique view using the Moore method, and the chest axiolateral view, also known as the Kurzbauer method. Typically, the films are taken from an anterior oblique position and a lateral position to properly visualize the sternum structure. Order exam, sternum 2 views, header, right anterior oblique and lateral views of the sternum, history of fracture. Comparison, CT chest, abdomen and pelvis, 5/1/2022. Findings, irregularity of the superior manubrium with increased sclerosis. No interval displacement or angulation since 5/1/2022. Unremarkable sternomanubrial junction. Impression, unchanged alignment of the manubrium healing fracture. Let's review the appropriate ICD-10 coding and modifier selection for this sternum series exam. The clinical history indicates a healing fracture of the sternum. The radiology report notes an irregularity and increased sclerosis of the superior manubrium, but no interval displacement or angulation since the prior imaging on May 1, 2022. This confirms the fracture is stable and healing. The most accurate ICD-10 code for this condition is S, 22.21. XD. Fracture of manubrium, subsequent encounter for fracture with routine healing. Since the radiologist specifically mentions increased sclerosis of the superior manubrium, the coder can choose the specific location of the fracture within the sternum. Since this imaging exam is a follow-up study to monitor healing, and there are no new complications or changes, the appropriate 7th character is D. This indicates a subsequent procedure within the global period related to the same injury. This ensures that billing accurately reflects the follow-up nature of the exam rather than a new episode of care. While these exam has been traditionally used for sternum and sternoclavicular joint evaluation, it's becoming increasingly obsolete in many facilities, because CT imaging has largely replaced the need for multi-view X-rays of the sternoclavicular joints. With a CT scan, radiologists can get detailed cross-sectional images of the bones and joints with superior clarity, eliminating the overlap of structures that can occur in plain films. It's faster, more accurate, and often the preferred method when trauma, dislocation, or inflammatory joint disease is suspected. So while these CPT codes are still valid and used in some facilities, especially those without advanced imaging capabilities, many providers now go straight to CT for a clearer and more comprehensive evaluation of the sternum and sternoclavicular joints. Thanks for watching. Be sure to check the links in the description for helpful resources, and subscribe for more radiology coding content.